You ever find yourself wanting to really get a handle on something, but, time just isn't on your side?
Yeah, you want the important stuff fast.
Exactly. You want those key insights, the stuff that really matters, without getting bogged down in endless details. That's what we're all about here.
Mm-hmm.
And today we're taking a deep dive into a fascinating medical topic, thanks to some really in-depth information we've got on acral lick dermatitis in dogs.
Right. And this is basically a situation where a dog develops this, well, persistent habit of licking one specific spot.
Just keeps going at it.
Keeps going. And unfortunately, that very licking starts causing skin damage. It leads to this really frustrating cycle of irritation, then more licking, and the potential for infection, too.
Oof. Yeah, that sounds pretty uncomfortable for the poor dog.
It's definitely a very uncomfortable and concerning issue for them, yeah.
Okay, let's unpack this a bit. So we're mainly talking about the skin itself, right?
Mm-hmm.
And the exocrine system, things like sweat glands.
That's correct. Primarily the skin and related structures.
And while I guess any dog can develop this, it sounds like some breeds are, well, more susceptible.
Yes, that does seem to be the case. We're often talking about the larger breeds.
Oh, really? Is there a reason for that, or just an observation?
Well, the information we have here specifically mentions breeds like Doberman Pinschers, Labrador Retrievers, Great Danes, Irish and English Setters, Golden Retrievers, Akitas, Dalmatians.
Wow, quite a list.
Boxers, Sharpies, and Weimaraners as being more commonly affected. It's, interesting that the age it starts can vary quite a bit.
Depending on the cause, maybe.
Likely depending on whatever initially triggers the licking, yeah.
Mm-hmm.
And it doesn't seem to prefer male or female dogs, no sex predilection.
Huh. And the larger breathing, any theories?
Well, one possibility to consider is maybe the increased weight or activity levels in larger breeds could make them perhaps more prone to initial joint issues or minor traumas that could start the whole cycle. It's just a thought.
That makes sense. A little bit of arthritis pain maybe leads to licking that spot.
Could be. Or just a bump or bruise they focus on.
Okay. So if someone listening suspects their dog might be dealing with this, what are the key visual signs they should be looking for? It's more than just like occasional licking, right?
Oh, definitely. It's persistent. Very focused licking of particular areas.
Whereabouts usually?
Most often it's on the top of the wrist or the ankle, technically. The dorsal carpus, metacarpus, tarsus, or metatarsus.
Okay, front or back legs.
Exactly. And this constant licking, it leads to hair loss alopecia in that area.
Right, see a bald patch.
You would. And the skin itself can become eroded, kind of raw looking, thickened. You might even notice raised. Firm patches called plaques. Scabs can form, and sometimes there's even some fluid discharge, some exudation.
And it could be just one spot. Or multiple.
It can be either single or multiple lesions.
Okay, so we have a good picture of what early lick dermatitis, looks like. Now, what's our mission here today? What are the core things we want you to understand about this condition?
Well, our main goal is to really delve into the potential underlying causes. What can actually trigger this behavior, then understand how vets diagnose it, by ruling out other possibilities.
Right, the detective work.
Exactly. And then finally, explore the range of treatment approaches available for what can be a really challenging condition to manage.
Sounds important. So let's get into the why. What typically starts this cycle of excessive licking in the first place?
What's fascinating, I think, is that it often begins with something seemingly small, like a minor localized injury or some irritation in that specific area.
Simple little thing.
Often, yeah. And this can then kick off what's known as a lickage cycle.
Lickage cycle, okay.
So the initial discomfort makes the dog lick, but then the saliva and the actual physical act of licking further irritates the skin, which causes more itching.
Oh, I see. And that leads to...
even more licking. It's a really unfortunate domino effect.
So a small thing can escalate quickly. But it's not always just a simple scrape or a bug bite, is it? I mean, you mentioned underlying causes. Can there be deeper health issues triggering this?
Absolutely. That's a key point.
Yeah.
The information we're looking at highlights a really wide array of associated underlying diseases.
Like what?
Well, we're talking about things like staphylococcal furunculosis. That's a deep bacterial infection in the hair follicles.
Nasty.
Yeah. Or various types of hypersensitivities, allergies, basically, to things in the environment or food.
Okay, allergies, common problem.
Very. Then there are hormonal imbalances, what we call endocrinopathy. Parasitic infections like dermatitis from skin mites, fungal infections, dermatophytosis, which you might know as ringworm.
Right.
Even a reaction to a foreign body, like a sliver or grass seed, may be embedded under the skin, causing irritation.
Wow. So really could be a lot of different things just starting that initial itch or pain.
It really underscores how many different pathways can lead to this initial licking behavior.
And that list.
Yeah.
It doesn't stop there, does it? I think I saw more in the notes.
No, not at all. The list continues. It includes neoplasia, that's abnormal tissue growth, like tumors,
Okay.
underlying joint disease or arthritis causing chronic pain in that area, direct physical trauma, obviously,
Mm-hmm.
nerve-related issues like neuropathy or maybe some kind of sensory nerve dysfunction, and even psychogenic factors.
Meaning psychological, like
Es-
stress.
Essentially, yeah.
Mhm.
Psychological or behavioral issues like anxiety or maybe even obsessive compulsive type behaviors manifesting physically through licking. It truly emphasizes just how multifaceted the potential triggers can be.
Okay, so a dog comes in persistently licking one spot. How does a veterinarian actually figure out which of those, many possibilities is the culprit? How do they rule things out?
Right. The diagnostic process really revolves around systematically ruling out other conditions that can look similar, conditions that present with similar types of skin lesions.
Makes sense.
This is what we call making a differential diagnosis. Our sources specifically mention neoplasia, bacterial furunculosis, focal dermatitis, that's the mites in one spot, and focal dermatophytosis, the fungal infection, as key things a vet needs to carefully consider and exclude.
Through testing, I assume.
Through various tests, yes.
But what about just standard health checks, like routine blood work? Can that offer any clues?
Good question. Standard blood work, so a complete blood count, CBC, a biochemistry profile looking at organ function, and a urinalysis. These are often actually normal in dogs with acrylic dermatitis.
Oh, so not always helpful then.
Well, they can be helpful if there's an underlying endocrinopathy, one of those hormonal disorders contributing. Abnormal results there can definitely point you in a specific direction.
Ah, okay. So normal results don't rule much out, but abnormal ones might rule something in.
Exactly. So while normal results don't exclude the condition, abnormal ones can guide further investigation.
So if the standard tests are clear, they need to dig deeper with more targeted tests, right?
Precisely. To investigate those potential underlying causes we talked about, there are several specific lab tests and diagnostic procedures they might use.
Such as?
For example, to check for those endocrinopathies, they might run tests like a free T4 and TSH test, that's for thyroid function, or maybe an ACTH stimulation test, or a low-dose dexamethasone suppression test, the LDDST. Those assess adrenal gland function.
Okay, hormone tests. And what about getting a closer look at the actual affected limb itself, besides just looking at it?
Yeah, imaging can be very valuable, particularly radiology or x-rays.
What can x-rays show?
They can help identify things like neoplasia, those growths,
Yeah.
or evidence of recent trauma, maybe radiopaque foreign bodies, stuff that shows up on x-ray, like a bit of metal or gravel maybe.
Ah, okay.
They can also show bony changes that might have developed because of the chronic irritation, and even signs of underlying arthritis if the licking is happening right over a joint.
So quite a comprehensive look, visual and internal. What about looking at the skin more directly? Microscopically, maybe?
Yes, absolutely. That's where specific diagnostic procedures come in. Skin scrapings are pretty simple but effective for checking for Demodex mites.
The ones that cause dermatitis.
Right. A dermatophyte culture, a fungal culture, is used to rule out fungal infections like ringworm.
Okay.
Epidermal cytology, that involves collecting cells from the skin surface, maybe with tape or a slide, and looking under a microscope for signs of bacterial infection or yeast.
And if they suspect bacteria?
Then, crucially, a bacterial culture and sensitivity test is often done. This identifies the specific bacteria present and, really importantly, tells you which antibiotics will actually work against it.
Because resistance is a thing.
Exactly. And it's worth noting that tissue cultures, if they take a small biopsy for culture from deeper in the lesion, can sometimes give different results than just swabbing the surface.
Right. What's on top isn't always the main problem underneath.
Precisely. The deeper infection might be different.
You mentioned allergies earlier as a potential cause. Those seem super common in dogs. How do they check for those?
They are common. And if allergies are suspected, a food elimination diet is a really critical diagnostic step.
The hypoallergenic food trial.
That's the one. Feeding a very restricted novel protein or hydrolyzed diet for, 8-12 weeks usually. Then you gradually reintroduce specific food items to see if any trigger a reaction, like more itching or licking.
Okay. What about environmental allergies, like pollens?
Right. For those, intradermal allergy testing, like the skin prick testing in humans, can be used, or
Hmm.
sometimes blood allergy testing, though skin testing is often preferred. This helps identify specific environmental allergens like pollens, dust mites, molds that the dog might be reacting to. That's what we call atopy.
Atopy, got it. And you mentioned biopsy, too.
Yes, a biopsy is very important. Taking a small tissue sample for microscopic examination histopathology. This is key to rule out neoplasia, those tumors, and also certain other types of infections or inflammatory conditions that you might not see just from the surface.
And it's not just about the physical body, right? Behavior came up earlier.
That's right. You absolutely need a thorough behavioral history from the owner. Understanding the context, when does the licking happen? What makes it worse? Are there stressful events? This gives clues about potential psychological triggers.
Like anxiety.
Could be anxiety, boredom, compulsive behavior. And furthermore, a comprehensive neurologic exam and an orthopedic evaluation are important too.
Why those?
To check for any underlying nerve issues or musculoskeletal problems like subtle pain or arthritis, that might be contributing to discomfort and starting that licking behavior.
Right, back to that initial trigger idea.
Exactly.
And if they do perform a biopsy, what specific changes are they looking for under the microscope that point towards acrylic dermatitis?
Well, the information indicates that on histopathology, there are several characteristic findings.
Yeah.
Things like epidermal hyperplasia, that's a thickening of the top layer of skin.
Okay.
Plasmacytic dermal inflammation, a specific type of immune cell infiltration deeper down. Inflammation around the hair follicles, folliculitis and furunculosis. Inflammation around the sweat glands.
Lots of inflammation.
Yes, perihydradenitis and hydradenitis, and often a pattern of scarring in the deeper dermis, kind of linear scarring, called vertical streaking fibrosis.
Okay, so seeing those things helps confirm it, assuming other causes are ruled out.
Precisely. It supports the diagnosis in the right clinical context.
All right. So diagnosis is clearly a really detailed process. Lots of ruling things out, investigating different angles. Now, let's move on to treatment. Once they have a better idea of what might be going on, what are the options for helping these poor dogs?
Yeah, and it's important to set expectations right away. Treating acrylic dermatitis can be quite challenging, especially if you can't pin down and manage that underlying cause.
Right, if you don't fix the trigger.
It's likely to come back. Our sources really emphasize that patience and consistent effort, often over a long time, are necessary for successful management.
What about tackling the behavioral part? Since the licking itself can become such an ingrained habit, almost compulsive.
Behavioral therapy definitely plays a crucial role, particularly when you suspect psychogenic causes, stress or anxiety.
What does that involve?
It involves working closely with the owner, identifying potential environmental stressors, anxiety triggers, maybe separation anxiety, changes in the household, and then implementing strategies to address them. Things
Wow.
like environmental enrichment, more toys, puzzle feeders, changes in routine, more exercise, specific training techniques, maybe working with a veterinary behaviorist.
Okay, and what about just physically stopping the dog from licking? Letting the skin heal?
Yeah, physical barriers are often a really necessary first step, or at least an early step.
The cone of shame.
The Elizabethan collar, yes.
Yeah.
Those cone-shaped devices are common. They physically prevent the dog from reaching the lesion. Bandaging the affected limb can also work, providing protection.
Does that help break the cycle?
It's crucial for interrupting that lick-itch cycle. It gives any secondary infections a chance to be treated and allows the skin itself to actually begin healing. You have to stop the self-trauma.
I've heard about therapeutic laser treatments being used for skin stuff in pets. Is that helpful here?
That's an interesting point. The information we have here, however, mentions a specific controlled study looking at therapeutic laser for this condition, and it didn't demonstrate consistent benefits. So while laser therapy might have its place for other skin issues, it doesn't seem to be a reliably effective primary treatment for acrylic dermatitis based on this evidence.
Okay, good to know. Probably not the first thing to reach for then.
Yeah.
What about diet? We talked about food allergies being a possible cause.
Right, so dietary changes are typically only recommended as part of the treatment plan if the diagnostic process strongly suggests a food hypersensitivity is involved.
So only if you've done the food trial and it pointed to an allergy.
Exactly. It's not a general treatment for all cases.
Yeah.
But if a food allergy is identified, then obviously a long-term hypoallergenic diet becomes a really crucial part of managing the condition.
And what about more invasive things like surgery to just remove the damaged skin?
Yeah, surgery, whether it's traditional surgical cutting or using a laser to remove the affected tissue, it's generally not recommended as a primary treatment.
Why not? Seems like it might fix it quickly.
Well, our sources indicate it can sometimes paradoxically make things worse.
Oh.
It might increase the dog's focus and attention on the area, potentially leading to licking of a larger surgical site. And crucially, if the underlying cause isn't addressed,
Well, they'll just come back.
very likely to recur, yeah, either in the same spot or nearby.
Okay, so surgery's usually out.
Hmm.
It sounds like medication often ends up playing a pretty significant role then.
It often does, yes. If there's a secondary bacterial infection, which is, quite common with these open irritated lesions,
Makes sense.
then antibiotics are often a necessary starting point. And ideally, the choice of antibiotics should be guided by those culture and sensitivity results we talked about.
Using the right tool for the job.
Exactly, to make sure it'll be effective. And it's important to realize that antibiotic treatment often needs to be long-term, sometimes at least 6 weeks, maybe longer, to fully clear up a deep infection.
6 weeks, wow. Okay, and what about systemic meds? Drugs that work throughout the whole body, not just on the skin.
Right. There are several classes of systemic medications that can be helpful. Often they target the underlying itch or maybe the behavioral components.
Like what?
Antihistamines, for instance. Things like hydroxyzine or chlorpheniramine. They can help reduce itching, especially if an allergy is
Do
suspected.
they work well?
They can help some dogs.
Hmm.
A common side effect, though, is sedation, drowsiness. Our info even gives typical dosages and how often they're given.
Okay, so antihistamines might help break that initial itch. What other systemic options are there if it seems more behavioral?
Yeah, certain psychotropic medications can be very beneficial then, especially when there's a strong behavioral or compulsive element to the lipping. SSRI, selective serotonin reuptake inhibitors, like fluoxetine, maybe paroxetine, these are sometimes prescribed to help manage anxiety and compulsive behaviors.
Like Prozac for dogs.
Essentially, yes, fluoxetine is Prozac. There are also dopamine antagonists like naltrexone, which can sometimes reduce the urge to lick.
Interesting.
And then there's another class, tricyclic antidepressants, or TCAs, medications like amitriptyline, doxepin, clomipramine. These can have both anti-itch effects and behavioral modifying
So
effects.
it's kind of a double whammy.
They can be, yeah. Again, our sources provide typical dosages, frequencies, and sometimes maximum dose guidelines.
It sounds like choosing the right one of those psychotropic meds might involve some careful consideration and trial and error.
Absolutely. And the information strongly emphasizes that starting, combining, or stopping these types of medications needs to be done very carefully, always under close veterinary supervision,
Why is that?
because of potential interactions between them or with other drugs the dog might be on, and potential side effects. You have to taper on and off slowly sometimes.
Right, makes sense. What about topical treatments? Stuff you put right on the skin lesion itself.
Yes, there are a few topical options that might be considered. One combination mentioned is flunixin meglumine, which is an anti-inflammatory, and fluocinolone, a steroid mixed in DMSO, which helps it penetrate.
Okay. Anything else?
Topical capsaicin products are another possibility. Capsaicin is from chili peppers.
Oh, so it burns a little to deter licking.
That's the idea, yeah. Create a sensation they don't like.
All right.
Interestingly, the info indicates that injecting corticosteroids directly into the lesion intralesional steroids is generally not found to be very helpful in these cases.
Good to know it's not typically effective, too. Are there any important precautions when using these topical meds?
Yes, definitely. It's generally recommended to apply them while wearing gloves. You don't want to absorb the medication through your own skin.
Good tip.
And it's crucial to prevent the dog from licking the treated area for, say, 10 to 15 minutes after you put it on.
To let it soak in.
Exactly, to allow time for the medication to be absorbed and also to prevent them from just licking it off and potentially ingesting it.
Right. Are there any specific medications mentioned that need extra caution or have contraindications in certain situations?
Yes, the information does highlight some important points there. For instance, doxepin, one of those TCAs, should be used cautiously if the dog is also taking certain other meds like MAO inhibitors or clonidine or certain painkillers or hormones because of potential interactions.
Race-drug interactions.
Right. And as we mentioned, antihistamines can cause drowsiness. And because those psychotropic meds can interact, combining or withdrawing them needs careful vet management.
Any serious risks with the TCAs?
There's a note about rare instances of cardiotoxicity, heart issues, and hepatotoxicity, liver issues reported in animals on TCAs. So if a dog is on them long-term, routine blood work monitoring might be recommended by the vet.
Okay, so ongoing monitoring sounds really key no matter which treatment path you go down.
Absolutely crucial. You need to closely monitor the frequency and intensity of the dog's licking and chewing behavior. That's how you assess if the treatment plan is actually working.
And keep looking for that underlying cause.
And, as we've stressed, identifying and treating any underlying medical condition is absolutely paramount. That's the best way to prevent the acrylic dermatitis from just coming back again and again.
Okay, what happens if they do all the tests? The skin scrapes, the cultures, the x-rays, the blood work, maybe even the food trial, and they just can't find a specific physical cause?
Yeah, that does happen sometimes. In those situations where a really thorough investigation fails to identify an underlying physical disease,
Then what?
then psychogenic causes, essentially behavioral or psychological roots, are strongly suspected. It might be considered a compulsive disorder or maybe a form of self-mutilation behavior driven by stress or anxiety.
And what's the outlook then, if it's purely behavioral?
Unfortunately, our information indicates that the prognosis in those cases tends to be more guarded.
Meaning harder to treat successfully long-term.
It can be more challenging to manage effectively over the long term. Yes, relapses might be more common.
Okay, so to kind of bring this all together, it sounds like acrylic dermatitis is way more complex than just, a dog licking its leg too much because it's bored.
That's precisely right. It's really a condition that often requires a very thorough, systematic investigation to try and uncover the underlying triggers. And as we've seen, those triggers can be incredibly diverse: physical, allergic, infectious, painful,
A
behavioral.
real puzzle
It
sometimes.
can be. And without identifying and addressing those root causes, achieving effective and lasting treatment can be very, very difficult.
So the key things for you, the listener, to remember are, it often starts with that self-trauma, that lickage cycle. Certain breeds do seem to get it more often.
Especially larger breeds.
A really broad spectrum of physical and even psychological factors can kick it off. And figuring out the why often involves that detailed process of elimination, the diagnostic workup.
Absolutely. And when it comes to treatment, the strategies can range widely from behavioral modification techniques and environmental changes to various topical and systemic medications, sometimes used in combination.
Yeah. And I think this whole discussion really highlights something important, doesn't it?
What's that?
Just how interconnected a pet's physical health and their behavioral well-being truly are.
Oh, completely. What might look like a simple, isolated behavior like excessive licking can actually be a significant flag, an indicator of more profound underlying medical issues, or perhaps deep psychological distress.
Right. It really prompts you to think, doesn't it?
Yeah.
About how sometimes seemingly minor symptoms in any situation really might just be the tip of the iceberg, pointing towards something much larger and more complex going on beneath the surface.
Well said. It's a good reminder to look beyond the obvious symptoms sometimes.